Mechanism of Celecoxib, COX-2 inhibitor, for pain management. 1. Selective COX-2 inhibition. Celecoxib selectively inhibits COX-2, cyclooxygenase 2, which is involved in the production of prostaglandins that mediate pain, inflammation, and fever, while sparing COX-1, which has protective functions in the stomach. 2. Reduction of inflammatory pain. By reducing the production of prostaglandins, Celecoxib decreases inflammation, leading to reduced pain, swelling, and tenderness in conditions like arthritis or injury. 3. Analgesic effect, pain relief. Celecoxib reduces nociceptive pain by decreasing prostaglandin E2, PG2, which sensitizes pain receptors, making the body less sensitive to pain. 4. Antipyretic effect, fever reduction. Inhibits the prostaglandins that are involved in raising the body's temperature set point in the hypothalamus, thereby lowering fever. 5. Lower gastrointestinal risk. Selectively inhibiting COX-2 reduces the risk of gastrointestinal irritation, ulcers, or bleeding compared to non-selective NSAIDs that inhibit both COX-1 and COX-2. 6. Reduced risk of bleeding. Since COX-2 is not involved in platelet aggregation to the same extent as COX-1, Celecoxib generally has a lower risk of causing bleeding than traditional NSAIDs. 7. Possible cardiovascular risk. While effective for pain relief, Celecoxib may increase the risk of cardiovascular events, for example, heart attack, stroke, particularly with long-term use or high doses. 8. Renal effects. Like other NSAIDs, Celecoxib may have renal effects, such as altering kidney function or fluid retention, especially when used long-term. Disclaimer: this channel does not promote or encourage any illegal activities, and all contents provided by this channel are meant for educational purposes only. Any copyrighted material on these slides is included as fair use for educational purposes only. It will be removed at the request of copyright owners.